Where's your red? I see the good doctor wears red. I'm rocking a little red. It's the only thing red I have. You?
I got to be honest, okay? Normally I'll fib every now and then. No fibs, no lies. I actually got up, I have to put a little red on. I said, okay, let's do that. Then I'm getting dressed and left the house. I go, I forgot to put something red on.
He forgot.
I need a red sweater is what I need.
We did not forget that it is Heart Health Month. It is Heart Day, as we like to say. Dr. Singh, thanks for being here. Cardiologist with Dignity Health. So you have people's hearts in your hands all the time.
Absolutely.
Nice. Absolutely. Making sure people are obviously taking care of themselves, taking care of their hearts.
Yeah.
Particularly Maternal Heart Health Month, we are focusing on. Why? I know that heart health continues to be a leading cause of issues in this nation. Tell us why we want to pay attention and focus on this kind of thing.
Yeah, first of all, thank you for having me. I'm Dr. Amardeep Singh. I am a cardiologist with Dignity Health and a volunteer for the American Heart Association. And Maternal Heart Month is super important. And I'm going to start off with a really sad statistic that actually our maternal mortality rate in America is one of the worst amongst the industrialized nations. And so we could do better in taking care of our mothers. There's a slew of cardiovascular diseases that can present during pregnancy, including hypertension, stroke, heart attack, blood clots, congestive heart failure. So super important to get health care during your pregnancy, and access to health care has been sort of the limiting factor.
Why is it the leading cause? And what are some of these causes, that are happening?
Yeah, so actually, maternal health begins even before you become pregnant. So making sure your blood pressure is controlled before you get pregnant, your blood sugar, making sure you don't have diabetes, your cholesterol. Listen, pregnancy is a huge stress on the body, right? It's like a phenomenal thing, but it's also a superhuman thing. So you have to make sure that your heart is ready to handle it. So there are hormonal changes that can happen in pregnancy that can affect the heart and promote blood clots and heart attacks and stroke. And access and education are very important.
Bless those mamas' hearts, man. Their bodies are working hard. They're baking a human.
Yeah.
And then they have all these other things they've got to worry about. But getting the care that you talked about is important, crucial, all the way before they're pregnant, and then beyond, postpartum. Talk a little bit about the importance to carry it on there.
Right. It's not all bad news. There's a lot we can do. So if you have a loved one who's pregnant, or you know somebody who's pregnant, reach out to them. Ask them, hey, listen, do you need to check your blood pressure? I have a blood pressure cuff. Or do you need a ride to the doctor's office? Or are you getting care? So you can do that. Dignity Health Methodist Hospital in Elk Grove has done a phenomenal job. They actually have a separate emergency department for maternal mothers. So they have an OB/ED. They have a board-certified obstetrics and gynecologist on call 24 hours a day. And so they really address hypertension, bleeding issues right where it happens. And they've actually reduced maternal mortality rates that way.
That's amazing. That's amazing.
It is incredible. We definitely all need to be aware. We're all worried about when certain things happen to us. Sometimes we might not be feeling that well. Yeah. What are some of the some of the warning signs, some of the symptoms that people might encounter?
So one is basically headache, chest pain, edema, swelling, shortness of breath. These are all symptoms of congestive heart failure or heart issues.
And so don't wait, I think, is one of the, you're feeling any one of those things. And I know a lot of things are going on, I would assume, in women's bodies when they are during the terms of their pregnancy.
Right.
But being hyper aware of that and not waiting a second to make a call and get help. I'm assuming that's one of the things we need to do.
Exactly. Postpartum, often mothers are so focused on the baby, so they're not really paying attention to themselves. So if you can support somebody and find out, hey, how are you feeling? How's everything going? Maybe you should be seeing a doctor. And really, if you're expecting, really be aware of any symptoms you have and reach out to your doctor.
Amazing.
Yeah, let the doctor know before if there is anything that's going on too as well.
Right.
Exactly, yeah.
All right, well, thank you for coming in. Great to see you. Happy Heart Health Month. A lot of work. I know your work with the American Heart Association, I'm sure they are just so thrilled to have you a part of it. So
thank you so much.
Thanks for being a part of the show today.
Thanks for coming in.
Yeah. American Heart Association information, heart.org. All the socials there for a little more information. And take care of your heart. Take care of your heart. That's it.